You're watching Shasta's Teen Journal, and I'm your host, Shasta Garcia. And I kind of want to just give you guys a quick update on my TV world business. And I'm actually starting a new talk show at the end of this year, which is going to be called Shasta's Journey. And it's going to be about my path to a purpose. And along the way, I meet so many incredible people with stories that could heal, teach, or inspire one of you out there. And I think it's just going to be stories that people need to hear. And so I'm really excited to start this new journey with an ending, of course, of Shasta's Teen Journal, which is going to be really incredible. I actually have 3 specialists in the field of cancer, and we are doing a 2-part series of breast cancer awareness. And on part 2, I actually am going to be interviewing 2 survivors. They have incredible stories, and I hope that they can give you hope if you ever have to do that journey as well. And I cannot wait for you guys to follow me along my new chapter of my life with Shasta's Journey. So let's go ahead and interview my 3 guests. All right.
Hi, I'm Kathie. I'm a registered nurse at the Mark Twain Cancer Center. I am one of the Infusion nurses.
And I'm Chris Stevenson. I'm also an RN at the Mark Twain Cancer Center, and I work on the Infusion Center side with Kathie.
Okay. My name is Elaine, and I'm a registered nurse, and I work at the Mark Twain Cancer Center. And I primarily work with Dr. Singal and assisting the patients with education and advocacy, whatever they need help with along the path as far as scheduling their appointments and their follow-ups and prescriptions. So.
And how long have each of you been in the field of this business?
In the field of oncology?
Yeah.
It's really hard to say because it just comes with with the territory sometimes. Specifically about 15 years.
Wow. And how about you?
For me, about 6 years. I started as a bone marrow transplant nurse at University of Alabama, Birmingham, and then started working in bone marrow around the country. And in the Mark Twain Cancer Center, I really have expanded my territory into all divisions of oncology. So in that sense, it's a little bit newer to me. About 6 years to answer your question.
I feel like territory is one of our words for these episodes, I think. And what made you want to go into the field of oncology?
I fell into it, and it was the best thing that could have happened, actually. I don't think there's anybody out there that doesn't have a family member or close friend that hasn't been touched by cancer. I got, at my old job, I got drawn into working in the pharmacy, which put me into the position of coordinating with that hospital's cancer center and sending patients home on chemotherapy. So that's what I started doing and progressing from there to being exclusively an oncology nurse.
With oncology, you spend a lot of very close quality time with your patients, and they so often become your friends.
Exactly.
There's so much time that they're in the infusion center, they're getting their chemotherapy or their blood or their antibiotics or whatever it may be, and that can take hours, and they're 2-3 times a week, even more sometimes, and that aspect where the people become such friends is very appealing to me, and that's probably the biggest reason why I like it so much.
Elaine, what made you go into this field?
I started in oncology nursing 30 years ago, and I worked at the University of Washington and Fred Hutchinson Cancer Center in Seattle in the bone marrow transplant unit, and then moved down to San Andreas, and so I was thrilled when the Mark Twain Cancer Center opened as an opportunity to re-enter that field, and I love working in oncology.
And what is your favorite part about being able to help women or men with breast cancer?
It's the closeness we develop with them. We see them on a daily basis sometimes, not just they're in the hospital for 3 or 4 days and they go on with their lives somewhere else. We follow their journey. Sometimes it's a happy ending and sometimes it's not, but we make, as Chris said, we make friends.
Yes, and there's a lot of humor, at least in our little cancer center.
Absolutely,
it's
yes.
Funny to be there.
Yeah.
And people that come for the first time are so surprised because we know each other. There's not a TV in our cancer center, and we did that on purpose so that the people would interact with one another and learn from each other and trust each other and help each other and become friends with each other. And we joke tremendously, and a lot of that is ribbing each other a little bit, and men especially like that. So that's my favorite part, is the humor.
And we kind of discussed this before we went on air, but as far as men having cancer, you don't hear that very often. So it is possible, and it is called breast cancer.
Yes.
Correct.
I'd say about
Absolutely.
1% of breast cancers are men. There's probably 2,000 cases in the United States per year or so. 450 men die of breast cancer each year. And I've had men patients with breast cancer that have passed away. And yeah, it happens. It happens. And men, while we don't need to do breast self-examinations probably as rigorously as women, still ought to be done. If you feel something, you need to report it just as if a woman did.
See,
Absolutely.
I don't think men are prepared for that at all. I don't think that they hear about that whatsoever, because mostly it's, fight like a girl. But I mean, I didn't know that, it was possible for men too, but I guess so. I mean, it's a cancer, right?
Yes.
Exactly.
And as far as breast cancer goes, there's a lot of different types of breast cancer that I don't think a lot of people are aware of either. I mean, they just think, breast cancer. But would you care to explain a little bit about it, Kathie, of the different kinds of breast cancers?
It depends on the cell, the actual cell that turns cancerous. I'm not exactly sure how to explain it, but you have one condition called inflammatory breast that is extraordinarily aggressive and fast, rapid growing. You can watch it almost grow.
There's invasive breast
And then
cancer
invasive.
and non-invasive breast cancer. Non-invasive breast cancer sometimes is not even considered a cancer. It's where it doesn't move from the duct or from the lobe into the surrounding tissue. And then there are the other breast cancers that will move outside of in situ, which is just in a little encapsulated space into the surrounding tissues, and then they can move into the lymph nodes, and then they can move to distant organs, and that would be considered stage 4 breast cancer.
Oh, and you also said before we were on air as well, is that somebody that was only a freshman that got breast cancer. You don't hear that very often either.
Yeah, and so starting at a young age, girls need to start doing self-breast exams.
So about when they
and
get their period, you think?
that would be
Absolutely.
fantastic, and it's just a good life practice to get into. Secondly, if someone goes to their practitioner for their annual exam, and maybe the breast exam is just going like this, you got to put your hand up and say, wait a minute, do a complete breast exam. And that really involves, thoroughly and deeply feeling the tissue as well as under the arms. And so it's partly starting young and doing it on a regular basis so that it's a life skill. And secondly, if you're being seen by a doctor or a practitioner, that they do need to do a really thorough breast exam.
And as far as, those who don't know, do you have the steps as far as, how to go about giving yourself a breast exam? Any steps?
Well, as a man, often I'll just say, well, instead of me, showing you how to do it on myself, perhaps you should just Google it, because there are some very good things. But in general, you want to know your own breast. Okay, you want to
doing
feel
it often. Just feeling around.
You want to feel in a circular pattern from the areola
So to know
around.
how you feel. So if there was ever something different.
Yeah. And then go far into the axilla. Because a lot of breast cancers in the armpit area, more than just right around what we think of as the breast. It can go far up into the tail. The axilla, yeah.
Yes.
It's armpit, yeah.
Oh, sweet. I learned something new.
And the other thing is that, for women, you're going to put your hand behind your head and both hands behind your head, stand in front of the mirror, look for any asymmetry. You're going to notice if there's any discharge from the nipple. And as Chris described, work from the inside out in a circular motion and go way up under the underarms. The first doctor I worked with would say to every patient when they would come in, do you notice any new lumps or bumps? And it's just a real simple way for everyone to notice if there's anything unusual.
Well, I'm sure it definitely helps during the diagnosing process if the patient's already done it and they're kind of aware, there's something wrong here. What are the symptoms that somebody could be looking for as far as, even if, is there always going to be a lump?
No, in fact,
Absolutely
in the early stages, you could be completely asymptomatic at all, and you may not be able to feel any lump. But that's why people over 40 should get a mammogram yearly, because the mammogram will see these small, cancer pockets or cells before you can feel them. So that there may not be any symptoms at all, but when they start, you could have some pain. You'll see some skin issues, thickening or orange peel kind of thing. Nipple inversion you see sometimes, or of course discharge, which is often pink or bloody.
I've been doing a lot of research and I didn't hear any of this. It's kind of sad. So I'm glad we're getting some of this knowledge out there for others. So hopefully whoever's watching this can, be taught something new. And I'm sure there's going to be. And what were the symptoms that somebody could be looking for, Kathie? As far as if there's any.
As you said, if you obviously would be a lump or any malformation in the breast, if your breasts aren't symmetrical. Rippling or pitting of the skin, thickening of the skin, as he said, kind of an orange peel. I mean, you may think, you've gotten a rash of some kind, but it doesn't go away with regular treatment. That would be one symptom you'd want to look for. Pain is always you always hear that the tumor doesn't cause pain. Obviously, that's not true.
Well,
tumors do cause pain.
Women are pregnant or on their period, their breasts are. I mean,
exactly.
For the most part, but a little tender, I guess.
If you've got a lump that's large enough for you to feel, there's no reason why it shouldn't be painful. I mean, if you squeeze it, it's going to hurt.
Yeah.
So that would be one thing.
And Chris, what are some of the treatment options as far as that you guys give here at Mark Twain Cancer Center for the patients?
Basically, for women with breast cancer or men with breast cancer, there are three different things. There's surgery to remove either the cancer or the breast. There's radiation, which is it covers a larger area, and then there's chemotherapy, which is systemic. It hits the whole body, and any cancer cells that may have been drifting from the original primary site. So those are the big three.
And what are the effects that those have on the body as far as the different treatments go?
Oh, none of them are pleasant. I mean, you have to be honest with it. Chemotherapy comes with the hair loss, depending on the chemo drug you're being given, the hair loss, the nausea, the vomiting, the constipation and diarrhea, and pain. Radiation is mostly comes with exactly the same symptoms as the chemotherapy causes, with the added fact that the radiation burns the skin. So then you're dealing with skin that is being cooked, literally.
Kind of like a bad,
it's painful.
Bad, painful sunburn for radiation.
Exactly.
Yeah.
We don't want to scare anybody from having treatment by saying these things, because we do a pretty good job of trying to alleviate those symptoms and do have prophylactic measures to combat these things before they happen.
And what could somebody do, Elaine, before they go into treatment or they're getting ready for the treatment process? Is there anything in particular that somebody could do beforehand?
I think, as we've heard people talk about, their family support is important, but then I would also say to follow the recommendations of their doctor. If the doctor needs 3 different tests done or scans done, it's important to follow the steps that the doctor, there's an appropriate pathway to go through to get the test done that will show exactly what needs done, and important to do that, get a second opinion if necessary, but very important to not, if there's been a diagnosis made, to not ignore that diagnosis or kind of put it off, but to follow the doctor's advice.
And then going a little bit back, what exactly do you guys do to diagnose breast cancer, and how does the treatment process change, depending on how the diagnosing went?
It's diagnosed hopefully by a woman finding the first symptom herself, because that's the earliest. The annual mammograms over 40, in some cases more often if there's something that's suspicious. If they do find something suspicious, then we move on to the MRIs, the stereotactic biopsies, PET scans occasionally, although that's at the farther end. And that's mainly what we do. We don't get into the crossing the type of cancer it is, the genome or whatever you want to call it. We treat it first. That's the most important thing, is to get in there and treat it.
And one thing that we do offer at our office is the BRCA testing, which
Yes.
is the gene mutation testing. So we do that right in our office. It's either a blood draw or it's a mouthwash that's sent out to a lab that does the BRCA testing. Another thing that I want to mention that is done at Mark Twain Dignity Health is that every month there's a tumor board where all the doctors get together and discuss certain cases. It's the surgeons, the radiologists.
Is that open to the public?
It is not. It is. It is among the physicians and the medical staff, but it's the surgeons, pathologists, radiologists, oncologists. A lot of times the pharmacist, the nutritionist. Will all meet and they'll discuss if there are certain cases, and sometimes they'll have a little back and forth, as well as the radiation therapy doctors, and come to the best mutual agreement on treatment for different patients. They don't discuss all the patients, but maybe there are some they have concerns about. So on a monthly basis, collegially, they all look
That's
at the
good to hear.
patients.
That's
It's
good to hear.
fantastic, yeah.
Yeah. And Chris, how is breast cancer different from other cancers, if it has any differences at all?
Breast cancer gets a lot of funding. Yeah, sometimes, when we're thinking about giving our dollars for research, breast cancer is right out there, and there are other, equally deserving cancers like ovarian cancers, and for men, prostate cancer and lung cancer is so prevalent. But that didn't really answer your question. What was your question?
Oh man!
That's true.
How is it different as far as the way it affects your body inside and out compared to other cancers? If there is any, if there's not, there's not.
we hear a lot about alopecia, which is the hair loss, and women are emotionally tied to their hair, and I understand that. What's interesting though is when you come into the Mark Twain Cancer Center is that we don't even notice bald women. We don't notice that they're bald. It's funny that way.
Yeah, no.
They're a person to us. They're not their hair. But I know when they go out into the public, it's it can be emotional, and I understand that, and we try to help people with that. But cancer is cancer, and in the Infusion Center, and all of these people have something in common, and they're able to share their unique perspective, whether it's breast cancer
Along
or
their
prostate
journeys.
cancer. Yes,
Everybody has
very
a different
interesting.
story on how. How it goes. I mean, even with the two survivors that I'll be interviewing on the next show, they both have completely, as far as, their stories do intertwine, but at the same time, they both had to take different journeys and different roads and led them down different ways. But it's very amazing that they have, really amazing stories that they could help share.
I think it's important to note it's not just breast cancer patients lose their hair.
That's true.
Yeah.
A lot of them do, and men can be just as upset by the hair loss as women. Not as much, of course, but still. And in my experience, I find most women go for the wig at first, and then they go to hats, and then as long as it's warm outside, that's like, oh, forget it. I'm comfortable in my body now. And I'd rather not have the itch and the sweat from the wig.
Yeah. Chris, do you think that somebody should consider chemotherapy before surgery?
I think that they should follow the advice of a doctor that they trust, because it depends on your individual situation. Sometimes they want to just do surgery, and sometimes they want to start with chemotherapy and then do radiation and then do surgery, and it becomes very complicated. It really does. Dr. Singhal, whom is our oncologist, is very, very good at explaining different options, and if you find an oncologist that you trust, like Dr. Singhal, do what she says.
I definitely hope I get to interview her one day.
You should. She's wonderful.
Very interesting woman.
Elaine, is there anything that you can share with me as far as side effects and risk that chemotherapy might have on somebody?
I think Kathie mentioned a lot of those. Nausea and vomiting, hair loss. For a lot of people, their white count falls, and so because of that, they are more susceptible to infection. They're immunosuppressed. So they have to be careful when they're out in public, be really careful not to be around someone that's
So
sick.
their immune systems are
Yes.
Compromised.
But
A lot.
also, another thing is that not only with breast cancer patients, but all cancer patients, every person is unique, every cancer is unique, and because of their treatment is unique. They may get chemotherapy before the surgeries to shrink the tumor, then have the surgery, and then have radiation after. There may be chemotherapy only. The chemotherapy may be once a week, it may be once every 2 weeks, it may be once every 3 weeks, it may be once every 4 weeks. It depends on each person, the type of cancer, the exact type of cells or pathology, and it is a very unique and precise treatment for each person.
And Chris, as far as, preventing breast cancer, is there anything at all that women can do or men can do to prevent it?
Sure, yeah. You should avoid ionizing radiation, but that's pretty easy. You get that like from a nuclear power plant that explodes, or you might get that from being
Tanning
in
beds.
Yeah.
Is that bad?
Tanning
Well, yeah,
beds,
and
you can't have-
solar radiation you should certainly avoid.
Is it-
Although you're more likely to get skin cancer
is
from
it
that.
true if
but-
you put your phone in your bra, is it true that radiation and that thing can cause breast cancer?
I have not seen any real studies that have
Okay, because
suggested
I've
that.
seen stories on there, but I was
Yeah.
just
Yeah,
wondering,
that's-
Anecdotally, you'll hear all kinds of crazy things, but real scientific studies I don't know of that have suggested that that's a cause. But just chemicals in our environment you should avoid
I think
as well.
everything nowadays that we consume, products that we use,
One must be careful.
they all pretty much cause cancer nowadays. I mean, they really do. It's sad. It is. But I want to kind of go into as far as what keeps you going after seeing so many people throughout your job. What keeps you going during the process of working with so many different people?
You kind of touched a nerve here, so yeah, we can talk about this.
Yeah, but it's hard to talk about.
Yeah.
For me, it's for every patient that has a bad outcome, I feel like I've been able to play a part in making their journey more comfortable for them. And there's always the 2 or 3 that at the same time we celebrate the fact that, today's your last chemo and there's a major chance I won't see you back here again. It is hard. We become emotionally attached to our patients because of the environment we set up. It's kind of homey.
Yeah. We don't save every patient. That's the fact of life. People die.
And we
It's
go
very
into
sad.
it knowing that.
Yeah, but it's still tough.
And we cry.
Yeah, and where we are, because we've become so close, it's tougher. It's tougher. I know it's tougher for the families. It's obviously tough for the patients to understand their own mortality. But what do? You try to be their friend. You try to be honest. You try to help in any way you can, alleviate symptoms, make them comfortable, joke with them. But when they do pass away, we very often will go to their services. Lots of hugs.
Yeah.
I don't know.
Tears.
Yeah, it's tough.
As Kathie said, it's trying to do everything that we can to help them through their journey, whatever it takes to help them that makes things easier, and then actually being able to be there as the doctor is examining the patient and helping the patient, just seeing the compassion on the doctor's part, and the fact that she'll bend over backwards to try to help someone is really fantastic.
You guys gave me goosebumps throughout all those, but it's really refreshing to see my small little community have such a wonderful health team, an oncology team. It's really incredible. I cannot wait to talk to Dr. Singhal. You guys are just so incredible. Thank you so much for everything you guys do. I cannot even imagine how much you guys have to do each and every day. That really goes into just one person. And so is there anything behind the scenes that not a lot of people hear about that goes into the job in the effort to, make their journey not end, I guess. Is there anything that I might have to
That
do?
goes on behind the scenes?
No, I mean, as far as like, what kind of things do you guys have to do when the patients are not around? Like, their tests or.
There's a lot of science, and so
Science.
we have a thing called Journal Club where we get together, the nurses, and we review the literature that's in our trade journals, so that we stay on top of it. And physicians do that more than nurses do. So there's a lot of time devoted to that and trying to keep up with the science. And there are a lot of people in the team that you don't often see. The pharmacists, well, luckily at Mark Twain, the pharmacists come into the infusion center quite a bit, but in many places they don't. But we, as nurses, we consult with them quite a bit. We're on the phone with those guys all day long.
All the time.
Yes, yes. And other people from the couriers and the housekeeping staff and the CEO of Mark Twain, Craig Marks, and these guys. We're always talking to these guys, and there's a lot of time and energy devoted to all of the people at Mark Twain as well as just the patients too.
And we've even added a social worker to our department now. That
Yeah,
can
Karen,
help.
she's great.
Karen, that is able to meet with the patients to discuss emotional needs as well as financial needs and that the patients have. So those are things that most of our patients aren't aware of.
Yeah. I know as far as me working with Calaveras Enterprise, just the smallest little things, just getting a newspaper out there. People pick up a newspaper, they get it delivered to their house, but there's so much going on behind the scenes. That's why I was kind of wanting to ask you, because just the simplest little job, somebody answering the phone can make such a huge difference. I mean, just imagine if you didn't have them. So that's why I asked that question.
Yes.
We do have a number on the screens, Mark Twain Cancer Center, 209-754-9670, so you guys can go ahead and call them if you have any questions, or if you want to make them the people to help you along your journey with cancer. I sure hope you do decide that. I cannot wait to hear a little bit more from Dr. Singhal. I think it's going to be great. Is there anything that you wish that people, the general public, had a sense of when it comes to breast cancer? Whoever wants to.
I think that just the importance of breast self-exam on a regular basis, a monthly basis, and then following up if there are, any concerns about that. Being an advocate for yourself and as a patient, being sure that you get what you need.
And I don't know who can answer this, but this might be a myth too. I don't know. Like I said, I have to go into this show like I'm a kindergartner because I have no idea what I'm talking about. But it's okay. I love learning new things. But as far as I heard that, wearing bras all the time, does that affect your chances at all, or is it more inherited?
I've never heard
You've never heard of that?
never
I
heard
have.
that.
I was doing research for an essay the other day, and it was something about like wearing bras all the time.
Was it about the irritation of wearing the bra? Because in the
Makes sense.
early days
Who
of
knows?
cancer theory, there was a theory that irritation could cause cancer, and in fact, sometimes it does, but it's very rare, and I've never heard anything
All
about
right.
it.
Well, thank you so much for joining me, guys. It means
Thank
so
you,
much to me.
Shasta.
And thank you guys for watching. It means, honestly, the world to me. Thank you so much for following me along my journey of Shasta's Teen Journal, and I hope that you continue to follow me along my path to a new talk show called Shasta's Journey. So go like us on Facebook if you're already liking Shasta's Teen Journal. Do not worry about it, and go like www.shastasjourney.weebly.com. I knew I was going to do that, but thank you guys, and I hope you continue to follow me. I'm talking way too fast, but I look forward to having you guys come along with my new journey that's going to begin. So have a blessed day. Bye.